Well, good afternoon. A couple of months back, in fact, on June 1st, we announced with some urgency our concerns about what was happening in Imperial County, California. The county had experienced a significant rise in number of transmissions related to COVID-19. Concern was made more paramount as it relates to the overwhelming situation for the hospital system, not only in the ICUs, but the ability to provide for emergency care more broadly, diversion rates for ambulances, health care personnel questions, a lot of stress that was placed because of this pandemic on the county. On June 1st, we committed to a new process, a new protocol to help support the county in their efforts. Began the process of decompressing their hospital system. Over 650 patients were moved out of Imperial County hospitals into surrounding and neighboring communities. And in some instances, we even brought patients here into Northern California. We approached our strategy in the county more as a strike team, more as a unified command approach, something you would see more traditionally as it relates to how we organize and construct our approach to dealing with other emergencies like wildfires and the like. That process took shape again in the beginning of June at a time when we had transmission rates, positivity rates north of 30% in Imperial County. In fact, it peaked at 30.3%. You can see on this graph the number of cases reflected in Imperial County in the blue line, substantially outpacing the number of cases in the rest of the state. This graph certainly presents itself as a spike in cases in Imperial County. It required a new approach, new strategies, and new accountability structures, and that's exactly what took place. The model now, as we're referring to it, the Imperial model, was all about providing supports, building capacity at the local level, filling in gaps, meeting needs both on personal protective gear, not just personnel, meeting the needs of the hospital system, providing additional supports, new strategies and prevention from PSA campaigns, culturally competent messages that were delivered to individuals as well as businesses and more broadly the community at large, in addition to sectoral closures that we made abundantly clear as it relates to moving forward to address the concerns that were flaring up in certain sectors of the economy in the Valley. You can see on this slide the number of cases as they began to spike. We began to intervene. You can see the medical personnel that we began to send in around June 3rd. Where we worked with not only state and county and local officials, but broadened that support by getting a lot of federal supports as well from a number of federal agencies. You can see after those interventions were put into place, again, beginning with the decompression of the hospital system as a foundational principle, more targeted supports, and some additional sectoral changes as it relates to returning to a stay-at-home order. You could see that line spiked and substantially began its decline. 30.3%, yesterday's positivity rate, still high, but at 11.2%. A successful approach, one that requires constant vigilance, one that we're continuing to engage in, but one that long-windedly has now become a model in terms of our approach, the Imperial approach, in other parts of the state. Last week, where we last joined each other, I began the process of announcing strategies in the Central Valley, in 8 counties in the Central Valley, for the obvious reason you can see exampled here on this chart. We're starting to see not only an increase in the positivity rates. I mentioned last week where I made some announcements about our interventions in Central Valley that we saw positivity rates on the lower end in Fresno at the time at 10.7%. And peaking around Tulare at a 17.7% rate. Not where we were in Imperial, but we don't want to see it go to where Imperial went. And that's why we felt it was appropriate to intervene using the information, using the experience, the best practice, the data collection, the approach in Imperial, and beginning that approach in the Central Valley. Why the Central Valley? Well, again, this slide underscores the concerns. You're starting to see the hospitalization and ICU rates increase, not just positivity rates in the Valley, outpacing the rest of California. And if you ask me today what our biggest area of concern in a state as large as ours, it is indeed the Central Valley. We're seeing stabilization in other parts of the state. You'll see some declines in a moment when I make presentation, including some stabilization and some modest declines in Southern California. The Central Valley, again, reinforced by this slide, reinforced by our presentation in Stockton last week, and our announcement last week, is indeed the area of our most important targeted interventions. We are, again, doing everything we can to fill in local gaps and working with counties to assess their current dashboard as it relates to data collection, identifying whatever gaps may exist or persist in their respective communities. But more important than anything else, identifying partners, not just partners from governmental agencies, again, federal agencies. 5 out of the 8 Department of Defense medical teams are deployed now in the Central Valley. Again, federal partnerships, but also developing private partnerships, critical to develop partnerships with employers, critical to develop partnerships with non-governmental organizations, nonprofits, NGOs, to, again, build capacity and build our collective response with a unified command approach to addressing the concerns in the Valley. And so that's exactly what we highlighted last week. We built that partnership to include $52 million of new resources for disease investigation, for contact tracing, and for our isolation and quarantine efforts. In addition to that, we have been able to, and I want to thank the Sierra Health Foundation in particular, they have been able to organize a collective effort, $6.5 million of additional resources that philanthropy has brought to the table to supplement or increase, rather, the $52 million contribution that we announced last week. And this is for rent, supplies, really helping individuals with utility bills and the like, again, focusing on the most vulnerable and the most vulnerable families. And remember, this is, and Dr. Galley's made this abundantly clear in a number of his presentations, we've made it abundantly clear over the course of the last number of months as well. Disproportionately, this disease is impacting our diverse communities, disproportionately impacting the Latino community, disproportionately impacting the community in the Central Valley. And so when we talk about the Central Valley, I hope we can really paint a picture in terms of our consciousness of how impactful this has been on the Latinx community. And that's why our targeted interventions disproportionately are focusing on essential workforce, on farm workers, on critical workforce and hospitality, retail sector, and the like that is being impacted by this disease. And so I wanted to begin today, as we left off last week, reinforcing the merits of the approach we took in Imperial County, recognizing, again, good enough never is, recognizing, as I do, as we do, that the effort is ongoing. There's a constancy to our focus. There's not just a passing interest in these efforts. They're not episodic. There's a full-blown commitment to follow through, to bend this curve, to suppress the growth, and ultimately extinguish this virus, which is indeed our long-term goal, or at least mitigate its impacts through therapeutics and vaccination. As it relates to the efforts statewide to do the same, I want to give you some good news, and that is our number of positive cases yesterday was 5,739. That is a one-day number. And again, I've made this point abundant over the past, and that is I don't look to one-day numbers. They go up, they go down. There's some weekend reporting often that is example on Mondays. That's why the 7-day average becomes even more important. And that 7-day average you'll see at 7,764. That 7-day average, by the way, is down roughly 21.2% from the previous 7-day average. That's good news, 21.2% decline. The last time you saw a slide like this, the number was north of 9,800 daily average cases, 9,859 to be exact. So from 9,859 cases, 7-day average from a week ago, now down 7,764, a 21.2% decline from our previous reporting period. Again, that's case numbers, and I caution folks, look, I've said this in the past, others have said this, some for different purposes than the purpose which we reinforce this. As we increase our tests, you're going to see an increase in case numbers. I caution people not to focus as much on that, but to look at positivity rates and look at hospital rates and ICU rates in the state of California. They become more profoundly significant from the perspective of mortality, from the perspective of our healthcare delivery system and our capacity. We want to test as many people as we can, but the purpose of the test is not just to show a number. It's an effort to have a sense of where the community spread is, how we can mitigate that spread, how we can help support our contact tracers, isolate, quarantine people, and ultimately mitigate the impact to our hospital system and into our ICUs. And so that's why the positivity rate, this number, you've watched these presentations, you're very familiar with this slide, this positivity rate is so important. Here is extending on the narrative of some early good signs. 21.2% decline in the 7-day average total number of positive cases. But the positivity rate is also seeing a decline as we've increased our daily average tests. And you can see the number 126,000, almost 127,000 daily average tests, about 140, just shy of 149,000 tests yesterday, a little bit more than that the day prior. We actually reached 177,000 tests a few days ago. But our average daily tests continue to go up. The good news is the total number of people testing positive is now going down. We have gone down to 7%. This reflected in this slide over a 14-day period shows that 7.5% number that we presented to you on multiple occasions, now again tracking down to 7%. This is the 14-day number. I often provide you the 7-day positivity rate. That last time I was with you, we made a presentation formally with you where I shared slides, which was on the 24th of July, not the presentation in Stockton last week. The 7-day positivity rate was 7.8%, got to about 8% at its peak. The 7-day positivity rate is lower now than the 14-day. It's down to 6.1%. So 14-day positivity rate reflected in the slide, 7%. The 7-day positivity rate now down to 6.1%. It's not where it needs to be. It is still too high. But again, it is good to see this number trending down, not trending up. Not surprisingly, as we see positivity rate begin to trend down, increased number of people being tested, percentage of people being tested relative to the numbers being tested lower. We're now, not surprisingly, seeing hospitalizations go down modestly. 10% decrease in the total number of positive cases in our hospitals over a 14-day period. 10% decrease. The last time I shared slides with you, we had seen a 9% increase. Remember, it was as much as 50% a few weeks back over a 14-day period. So 50%, 9% growth. Now we're seeing 10% decline. Last slide set we shared with you over a week ago showed a 9% increase. So again, a decline in total hospitalizations. Not surprisingly, you'll see the healthcare system capacity with total number of patients declining. It's just shy of 9% of our total capacity. It's holding relatively steady, not increasing, as you've seen in some previous slides. Hospitalizations go down. We encourage to see ICU admissions also trending down. Last slide deck we provided, 11% increase in ICU admissions. You'll see reflected in this slide, 5% decrease in ICU admissions. So again, these are statewide numbers. It does not reflect the reality in the Central Valley. It doesn't necessarily reflect the reality where you're living in a particular county, a particular part of the state, but the overall trend, both, again, positivity rates, hospitalizations, now ICUs, is showing a decrease from where we were over a week ago. Encouraging signs, but 1 week does not make a kind of trend that gives us confidence to generate headlines. We are looking forward to that, and we'll need to see another few weeks of this kind of data to come in to feel more confident about where we are as a state. The good news is we do feel confident in our critical care capacity. The ICU numbers declining, the total number of ICU patients reflected here in this graph to our capacity dropped modestly from 23% to 9%. Hospitalizations about 9%, but did not decline, still within a percentage point here. We were able to see modest decline over the last reporting period when we presented this slide deck. 38 counties are now on our monitoring list. You'll recall 37 counties when we announced that Santa Clara County was added to our list when we were in Stockton last week. Now 38 counties. This includes San Mateo County on the list. 58 counties in the state of California, though, again, these 38 counties represent the vast majority of the population in the state. And this county monitoring list is profoundly important to all of you that live in those counties as it relates to the sectoral guidelines we put out, more restrictive in these counties than in other counties, and certainly more restrictive as it relates to reopening our schools. Goal ultimately is to get off this list for 2 weeks, and that gives us some confidence based on CDC guidelines, our own experience here in the state of California, to consider making modifications, and certainly along the guidelines that we put out, which relates to our public education system and private school system as well. That 14-day period is foundational in terms of any subsequent modifications to distance learning, which is foundationally required in these 38 counties. I'll conclude, as always, to encourage people, if you are living with an individual who's tested positive for COVID-19, that is incredibly important because of mixed families, multi-generational families. We're seeing a lot of spread now in people's backyards, their front yards, as well as in their living rooms. And that's why we thought it important to remind people of the importance, if you are living with someone who's tested positive or has come into contact with someone who's tested positive, please stay at home. Don't share items. Do the kind of disinfecting that is foundational in terms of mitigating the spread of this disease. We'll continue to highlight this area of focus as it continues to be one of the more challenging and vexing areas in terms of mitigating the spread of the coronavirus. Accordingly, we remind you, as always, the most important non-pharmaceutical intervention you can make is wearing these masks. Again, doing everything in your power to physically distance yourself from people that are not part of that cohort in your household. Continue to wash your hands more broadly and minimize mixing. I just want to reinforce this. It needs to be reinforced even more. Minimize mixing to the extent possible. Again, that mixing could occur in your backyard, your front yard, but also, again, in your living room when you bring people outside your immediate household over, extended family members, or just generationally, you are connecting with loved ones and mixing in a way that can increase the likelihood of the spread of the virus. And so that's the update for the day. I want to just make one final point of reference, and it's an important one, and that is total number of deaths in this state has increased over the course of the last few weeks. This, again, for us is a point of obvious concern, and for the family members, each and every life lost is devastating, and our heart goes out, including a young person in Fresno that lost their lives, a teenager. And this is a sober reminder of how deadly this disease is and how it can impact anybody. And while it's absolutely true, and I don't want to be an alarmist, it's absolutely true that number of people that contact this disease that are in their late teens, even early teens, the likelihood of death is very, very low. The reality is we tragically lost a teenager to this virus, and it's just a reminder, a sober reminder of how powerful and impactful and deadly this disease remains to be, and how important it is to do the kind of work we all must do as a society, as a community, and as individuals to do what we can to mitigate that spread, to wear those masks, to physically distance, to avoid the kind of mixing large crowds and outside your immediate household as much as you possibly can. 32 additional lives were lost in our last reporting period yesterday, but I want to just caution you, 32 is a lower number than you've seen in the past. The average number's now well north of 100, and with the increase we've experienced over the last few weeks, the lagging indicator always in terms of the deaths, this number is reflected as a lagging indicator, meaning we're likely to see those numbers remain stubbornly high over the course of the next number of days, potentially next week or so. We're going to monitor that closely. We'll talk openly and honestly as much as we can about it. I don't want you to be misled into feeling some more confidence about that 32 number. Again, look at those 7 and 14-day averages, not just one day over another day. 121 lives on average we've lost a day, as an example, just over the 14-day period as it relates to the deaths associated with COVID-19. So that's an update on where we are. I again want to remind everybody of the importance of targeting our focus and continuing to build capacity and build partnerships. We continue to do that county by county, health director by health director, and business by business. And I would be remiss, I'll just close on this. I want to thank the business community. We've been out, alcohol beverage control, and been out in bars and restaurants and circumstances, how grateful we are to all of you that are represented in that respect, and to all of the employees and customers that are doing their best as well under very trying and difficult circumstances. With that, of course, we're happy to answer any questions.
Katie Orr, KQED.
Hi, Governor. Thank you for taking my question. As